You might not even realize you suffered a brain injury, but the consequences of one can be lifelong. Why do brain injuries and concussions often go undiagnosed after an accident? They can occur whether it be a car accident where there's a whiplash injury, or a fall in which you fall and in addition to hurting your hip or your knee, you hit your head. Oftentimes the injuries and symptoms from a brain injury or concussion are very subtle. And at the urgent care especially, or if a client fails to go to an emergency room and they just go to an urgent care complaining of some neck pain or some knee pain or some hip pain from a fall, and they said, oh yeah, I bumped my head also, they often are not asked the right questions to properly diagnose whether you also suffered a concussion, which is also known as a traumatic brain injury. And the traumatic brain injury is kind of differentiated by regular traumatic brain injury or TBI injury, or an MTBI, which means mild traumatic brain injury. And in the scheme of things, the mild traumatic brain injury is the most common, where our clients come to us and their main focus might be on neck pain, and they might say, I've got headaches. And if it's a car accident, based upon my experience, I ask the appropriate questions and ask, well, how are you feeling? Did you feel dazed or confused immediately after the accident? What's the last thing you remember before being hit, and what's the first thing you remember after being hit? Those are the questions that a neurologist is going to ask you, someone specializing in brain injuries. Oftentimes they're like, come to think of it, I don't even remember being hit, and the next thing I remember is someone knocking on my window of the car asking me if I was okay, and I don't remember anything in between. So that proves that they suffered some form of loss of consciousness for a brief period of time. And that helps go to prove the diagnosis of a brain injury or mild traumatic brain injury. A loss of consciousness, the specialists of neurologists who specialize in treating traumatic brain injuries, they will say that a loss of consciousness is not necessary for the diagnosis of a concussion or mild traumatic brain injury. You can still have a concussion and mild traumatic brain injury even without loss of consciousness. Other types of symptoms that our clients tell us about are sensitivity to light, after an accident. They're like, it's very uncomfortable for me when I go outside. Sensitivity to noise, headaches, confusion, forgetfulness, irritability. All these things are really, in and of themselves, they might not be enough to clue in the victim that they've suffered more than just a neck injury or back injury, but altogether, when asked the appropriate questions, it leads to a diagnosis of concussion and mild traumatic brain injury. And a lot of our clients they develop PTSD for driving, some worse than others. They have severe anxiety. They may avoid driving altogether. They may, this is based upon my clients' experiences, they may avoid driving altogether. They may avoid driving their children in the car because they're afraid of what might happen. They become hypersensitive, and the doctors will call it hypervigilant, when they're either driving or even as a passenger in the car, such as symptoms of, a car came up next to me and it just made me freak out. That never was the case before this accident. So they become hypervigilant of other drivers. They're always worried about whether another driver is going to cause a similar accident to the one that led to this brain injury. The good news is that for some of our clients, those symptoms diminish with time, diminish after months. But what really helps is us getting our clients to the appropriate doctors, getting our clients evaluated by a neurologist, getting our clients evaluated by a neuropsychologist who is trained in the diagnosis and treatment of mild traumatic brain injuries and brain injuries themselves. And it's really important for the benefit of our clients to get that treatment started as soon as possible after an accident happens, because the medical literature and the medical opinions of these specialists is that the sooner you start treatment for the brain injury, the better you are able to recover from that brain injury, and more likely you're going to make a better recovery quicker with less ill effects for the rest of your life. But then there are some unfortunate cases that our clients suffer traumatic brain injuries, and sometimes they're still so subtle that only their loved ones can really tell the difference between the way their husband was before the accident versus after the accident. But the husband then has trouble holding down a job, has trouble, living without pain, without confusion, without forgetfulness, without severe chronic headaches. We're able to help our clients get to the appropriate doctors. And, the best thing is to help them get better as fast as possible. If you or a loved one suffered a traumatic brain injury, a mild traumatic brain injury, or a concussion after an accident, please reach out to us. I'd love to speak with you. I'd love to consult with you. I'm here to help, and I look forward to hearing from you.